Soundlife is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. In Soundlife, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children.
My hearing impairment improved tremendously, and I'm very satisfied with that.
Here at Soundlife Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Are you always flooded with a lot of questions and doubts about hearing loss and hearing aids information? Hi, my name is Aliyah Ching, founder and chief audiologist of Soundlife Hearing. Welcome to my YouTube channel, Soundlife Hearing. On this channel, we cover topics from hearing loss, hearing aids products, hearing tests, treatments, and service to guideline on how you can have better hearing. We will occasionally also host and broadcast different experts such as ENT doctors, pediatricians, and speech therapists to share their professional insight of different hearing loss issues and solutions. Listen to the real people with real experience about their hearing loss rehabilitation journey with Soundlife. By sharing this testimonial from our own clients, we hope to educate and create more awareness so that you may take your first steps to getting better hearing back to your life. Subscribe and hit the bell icon for notification so that you won't miss out on our latest videos update. Don't forget to check out our how-to tips and tricks of using hearing aids properly and some latest hearing aid brands video all sort out nicely in one place. Stay tuned and see you all soon.
At Clinic Zero, we believe reversing diabetes is possible. Hi, I'm Dr. Andrew. I help patients to reverse diabetes. By prescribing a low-carb, high-fat diet, we help patients to get rid of their medications, insulin injections, as well as supplements, so that they can regain the freedom of health.
Hi, I'm Dr. Jasmine. The reason I help people to reverse diabetes is because of in 2016, there was one patient who was admitted into the hospital, 40 years old Chinese gentleman, whereby he got a wound over the left shin. The wound was so deep that he required daily dressing and cleaning. In spite of him being very obedient, he took all his medication and injected insulin, but his sugar got higher and higher until the wound got very deep into the bone. That's why he required amputation after 2 weeks, in spite of me cleaning his wound every day. After that, he was unfortunate that he has to undergo the second operation, which was below the hip operation, and he got into a very severe infection where it took his life away. So he passed away within a month after his admission. That's why today I help my patient to reverse diabetes, because I know that the complications of diabetes is not reversible, but diabetes itself is reversible.
In 2013, I was misdiagnosed with a pancreatic cancer. They found a growth that is as big as a ping pong ball seated at the head of my pancreas. And without finding out what exactly it is, they offered me an operation. However, thank goodness, I insisted to find out what exactly is the growth, and therefore I escaped the 10 hours operation, because they later found out that it was actually a TB infection. These incidents taught me a very good lesson, and I told myself from then onwards, every time I see a patient, I must always look for the root cause. This is why today we help patients to reverse diabetes by focusing on the root cause of diabetes. The top 3 pain points of a diabetic patient is that, number 1, they have to take lifelong medications, insulin, or even supplements. Secondly, worst of all, despite taking all these medications, insulin or supplements, they still suffer from complications. Point number 3 is that when they suffer from complications, it's not just the money that they have to spend, but also the pain that they have to undergo alongside with their caretakers.
Our vision is to help 10,000 patients reverse diabetes by 2025.
Our mission is to use education to empower our patients so that they can reverse diabetes.
Currently, we have patients across 3 continents from the UK, Australia, Singapore, and Malaysia.
With the help of online consultation and a customized diet plan, our patients can see results as soon as 2 weeks. What if you can save up the money on medications as well as complications of diabetes and use the money for better purposes such as better education for your kids or even traveling around the world? Let's go back to zero. Zero medicine, zero worry, and live life to the fullest.
Join us in our next online health talk and let's reverse diabetes.
Hi, Natasha, you are muted.
Sorry about that. Hello and welcome everybody to our exciting stream where we will talk about the unseen connection between diabetes and hearing loss. So my name is Natasha. I'm from Soundlife Hearing, and today with me we have two knowledgeable speakers. They are expertise in their own fields. For the first speaker, we have our chief audiologist and founder of Soundlife Hearing. Please put your hands together for Miss Alia.
Hello. Hi, good evening, everyone.
And also, Miss Alia is the one who organized this. So thank you so much for organizing this talk tonight. And for our guest speaker, he has a very interesting portfolio. Now, our guest speaker is Dr. Andrew Chew. His background is that he's a reversing diabetes doctor, and he is also the founder of Clinic Zero. So since 2017, they have helped more than 1,800 patients to reverse their diabetes without using any medication, insulin, or supplements. And in May 2024, Clinic Zero is awarded Reverse Diabetes Center of the Year in Asia Pacific. Sounds very exciting, isn't it? So please put your hands together for Dr. Andrew Chew.
Hello, everyone. Yes, thank you, Natasha, for the kind introduction. And of course, thank you, Alia, for inviting me for this wonderful talk tonight. Right.
Thank you for
So, yeah,
joining us, Dr. Chu.
Yes, thank you so much, Dr. Chu, for making time to join us for this talk.
yeah,
So
pleasure.
up ahead, up ahead we have an interesting topic. So we'll start off with the first topic. Let's know. Can you tell us what's the? We'll talk about the introduction and prevalence of diabetes and hearing loss in Malaysia. So for Dr. Andrew, I have a question. What is diabetes and its prevalence?
All right. Diabetes. This particular word actually it comes from the Greek word. Diabetes means passing urine. Yeah, and of course we usually term it as diabetes mellitus. Mellitus is a Latin word. Mellitus means sweet. So in the past, that's how doctor diagnosed diabetes by tasting the patient's urine. So I thank God that I'm a modern doctor. I don't have to do that now. Yeah. So that is actually diabetes mellitus. That means there's actually sugar in the urine. So diabetes, the incidence, of course, now we are talking about Malaysia is pretty bad. We are talking about 1 in 5. So 1 in 5 adults in Malaysia is a diabetic. They estimated by next year it's going to be 1 in 3.
Wow.
That's huge. That's high.
That
So
is very.
diabetes deserve our attention.
Yeah.
I
Right.
see. So it's like 1 out of 5. That means if you are in an elevator and there's like 5 people, most likely someone has diabetes there.
Exactly. Yes.
Okay. Thank you so much, Dr. Andrew. Now, for Miss Alia,
Mm.
let's talk about hearing loss. How common is hearing loss among diabetic patients compared to those without diabetes?
Okay. I would like to share the one that original statistic for those who have purely hearing loss without diabetic first. So generally, that's based on WHO, World Health Organization. 1/3 of elderly above 65 years old, they are having hearing loss. Meaning to say that when they reach above 60 years old, there's 1/3 of the chance they get hearing loss. However, for those like younger age, maybe like 40s, in their 40s, there's about 10% of the chance they will have hearing loss. Then for 50s, there's around 15%. Okay, so the trend will be keep on increasing until there's a statistic from Yamasoba ad hoc, which is from US. They have done the prevalence of hearing loss for by age across 7 years old, 7 years, 2001 to 2008. So based on the study, those who are in their 70s, around 55% of them is having hearing loss, and those who are more than 80 years old, more than 80% of them are having hearing loss. So this is a generally statistic. So if let's say there is a graph, right, you will see that those are having hearing loss, it will be from the age maybe 0 years old until the one that having hearing loss, the graph will be like increasing like this. So hearing loss will increase with age. Okay, this is for those who are without any diabetes cause. However, for those who are having diabetic, research suggests that people with diabetes are likely twice as likely to experience hearing loss compared to those who don't have the condition. So it's also discovered that individual with pre-diabetic, which is not yet being diagnosed having diabetics, but maybe a little bit higher sugar level, or maybe a little bit higher cholesterol, they are 30% more likely to have hearing loss as well as compared to someone with normal blood sugar level. So this is basically the statistics. So there is a chart that I come across the study before. Just now I have mentioned for those at 40, 50s, their preference for having hearing loss is probably around 15% or even below 30%, right? However, for this group of people who has diabetes, their risk is actually double. Yeah.
Wow, those are very scary numbers. Yeah, if we don't know this, now we know, but if we don't know this, we might think like, oh, it's not important, but actually it is.
Of
Okay.
course it is.
So I'm sure like myself and you audience here, of course, we are wondering right now. So now that we know all these statistics, I'm sure we all ask ourselves, is hearing loss and diabetes reversible? Stay tuned to find out, everyone. So moving along, we're gonna go into the biological relation between diabetes and hearing loss. Okay, so for Dr. Andrew, I have a question for you. Doctor, could you explain how diabetes leads to health complications in general?
Right. So this is a very good question, and this is how it works. So we know that in diabetes, there's a lot of sugar in the blood vessel, right? So that's how we find out. Other than the tasting the urine, right? So the better way of finding out is basically to have a blood sugar check, right? So there's a lot of sugar in the blood vessel. So what happens when there's a lot of sugar in the blood vessel? It causes inflammation over the blood vessel wall, right? So that means there's injury over the blood vessel wall, and when there's injury there, this blood vessel wall, right, will actually get blocked. Okay, so this blood vessel over time will actually get blocked. So whenever the position of it gets blocked, right, that's where complication will happen. One example. So if the blood vessel is blocked in the brain, it causes stroke. Blocks in the eye, it causes blindness. Blocks in the heart, it causes heart attack. It blocks in the kidney, it causes kidney failure. It blocks in the leg, causes numbness, which is followed by amputation. So I believe in terms of hearing, it's the same mechanism where there's actually inflammation of the blood vessels in the ears, and that actually leads to the problem. And just now, Alia mentioned that the incidence of hearing loss among diabetes is actually double, right? Double of the normal population. So when it comes to the rest of the complications, actually exactly the same. Okay, so diabetic actually has 2 to 3 times higher chances of getting all the complications that I mentioned just now. So this is how diabetes leads to the complications generally in any patients for that matter.
I see. Oh, okay. Yeah, that's a very good explanation. I never thought about something like that. Like the blockage can affect different parts of our body. Now, for Miss Alia, could you further explain the biological connection between diabetes and hearing loss?
Yeah, sure. I would like to show my diagram here. So as what Dr. Andrew has explained earlier, this is actually our organ of cochlea. So cochlea is the organ, our organ of hearing that helps us to channel the sound, acoustic sound, and then become the electric signal and channel it to the brain so that we can interpret what sound was that. So as you can see over here, for this cochlea, it's actually covered by many blood vessels. The small one we call it capillary, and also the precapillary anterior. So when it's covered by this, right? What happened for this blood vessel? It will continuous to bring nutrients and also the oxygen to the organs. However, when someone is having high blood sugar, which is when inside their blood by itself is like glucose and insulin pathology, so somehow it will actually cause the nutrients bringing inside is actually reduced, or even it would interrupt the oxygen exchange level, because when it's high concentration of the blood sugar inside the blood vessels, the oxygen is sort of like no space and then cannot exchange with another the organs lah. Okay, so hence what happened once the organ of hearing, which is the cochlea, lack of oxygen or lack of nutrients, they are somehow degenerate faster. So when they degenerate faster, hearing is permanently affected. So the theory also say that abnormal blood glucose level affects the nerve lah. Not only the cochlea itself, but also the nerve. We have the acoustic hearing nerve, and which is the 8th nerve, combined together with the our balance nerve. So when this happen, it will cause hearing loss. So this is actually our cochlea. Inside the cochlea, we can see that we have different hair cell. But for someone who already have hearing loss, what happened is under the microscopic examination, this is what they will see, the damaged cochlea. So you don't see the same lining, like this one, the very nice lining. This is because the hair cell is already dying or degenerate. So one of the reason why they degenerate could be because of the diabetes condition, as I explained earlier.
Okay, so now it starts to make sense because of the blockage, and then because of the lack of oxygen and deteriorating. That's what can happen to our hearing when diabetes is involved. So, for Dr. Andrew, what are the signs and symptoms of diabetes?
Some of the early signs and symptoms of diabetes could be unintentional weight loss. That means somebody just weight loss without doing anything. So this could be one. This is because in the beginning part, because the body couldn't use the sugar, right? Because the sugar is staying in the blood vessel and not going to the cells. So the cells will actually start burning fats and things like that. Therefore, there's actually unintentional weight loss. So anybody who has unintentional weight loss, please don't be too happy, because that could be an early sign of diabetes. Some of the other symptoms could be numbness over the hands, especially in the fingertips. I have seen one patient where the numbness over the fingertips is so bad that she can't even button or unbutton herself. That's how bad it can be. All right, and some other symptoms could be night urine. I've also seen patients who actually wakes up like 3-4 times per night just to pass urine. So all this could be some of the symptoms of diabetes. But the most important and the most common symptom of diabetes is actually no symptoms. So
Really?
yeah, that's the most common one. Many times it just go undetected. Do you know that in Malaysia, 1 in 2 diabetics don't even know that they are diabetics?
Wow.
Because there's no symptom and most people don't check. Right? So they don't know lah. If you don't check, how would you know? You wouldn't know. Okay. So the moral of the story here is, I mean, if you are above 20 lah nowadays, because it's getting younger and younger, please go and get your lab test done. All right, your blood sugar done, so that you are actually aware of your condition. Yeah.
But I remember last time I went to the pharmacy, sometimes pharmacy also can have the, the prick one. That one's
Yes.
the quick one, right?
Yeah.
We just pay like 10 ringgit.
Yeah. This is actually better than nothing lah, because most people don't even do this because they're scared of the needle, right? Yeah. So they will actually go unnoticed. Yeah. So you can imagine, right? 1 in 2 diabetics in Malaysia don't even know that they are diabetic. That's how bad it is.
So if they don't know what happened,
If they don't know what happened, so how are they going to find out?
yeah,
When complications hit them?
which is the
Example,
one mentioned earlier,
suddenly,
the numbness.
Right. Not just numbness, it could be like a major one. Example, they have a stroke. Then suddenly they realize, of course, with a stroke, you get into hospital, right? In the hospital, obviously, they check everything, right? Then they found out.
Wow.
Yeah. So even like for your case, Alia, patients can come with hearing loss and they don't even know they're diabetic. If you were to check them, they could be diabetic.
Wow. True.
Yeah. Yeah.
Wow. So is it safe to say like every year we have to have our blood sugar checked?
Yes, at least once a year.
Really?
Yeah, and it's not expensive. Right? This lab test nowadays will cost you like less than 100 ringgit for a basic one, which will include this HbA1c already.
Yes, it's always good to prevent, to know and then prevent, than to actually treat it. Yeah.
Agree. Yes.
Okay. Thank you for that, Mr. Dr. Andrew. Okay, so for Miss Alia, is there a specific type of hearing loss that diabetic patients are more prone to?
I would say generally when we talk about type of hearing loss, we will categorize them based on degree, which is how severe is their hearing loss. So from the degree, we will do a test called pure tone audiometry test. And from there, the reading, we will categorize them how bad is their hearing loss. For example, mild hearing loss, moderate hearing loss, severe hearing loss, or profound hearing loss. Then the other one, how we categorize their type is, of course, we got do the masking, the bone conduction testing under this audiometry test. And then from there, we can tell whether they are having sensory neural hearing loss, mixed hearing loss, or conductive hearing loss. So generally, I would say diabetic patient is more prone to have sensory neural hearing loss or mixed hearing loss. Okay, very seldom they just have the conductive hearing loss. So the difference between these three is conductive is more affecting to outer and middle ear, and our sensory neural hearing loss is more affecting to the inner ear. So when it's to mix, it's actually either one outer or inner, or even middle or inner ear, something like that.
I guess the keyword is always the inner part. Yeah, right? Because based on our previous discussion as well,
Yes,
Yeah.
correct. Yeah, right.
Okay. In that case, then what signs should diabetic patients watch for that may indicate early hearing loss?
What signs? Well, over here, you can see that I have these symptoms of hearing loss. Okay. So the warning sign of the hearing loss is that if let's say someone they can hear sound but they cannot understand, this could be the sign of hearing loss. Or even they cannot hear clearly, and they can hear half like that, but they always require repetition from the speakers, or they will say they can hear well in a quiet situation but they are struggle in a noisy place. All this is a signs as well. So sometimes when they are having hearing loss, it's not necessarily their hearing loss will be equal. Some of them will have one better hearing, the other one is poorer hearing. So what they will do is that they tend to turn the better hearing side, turn one ear to the speakers. For example, the speaker is coming from this direction and this is my better hearing. I will need to turn like this, then only I can hear them well. But for a normal hearing person, normally generally if like some sound coming from your left or from your right, even without you turning your head, you still can hear them well. So another thing is that they may also have difficulty to hear phone conversations. But however, I do realize that nowadays because of we are using smartphone, not like the conventional telephone, the wire one at home. So hence, this symptoms is slightly lesser to notice. Okay. The other signs, including also for those who likes to keep their TV or radio volume higher, or they tend to miss out some telephone rings or doorbell. There is also some of them may have this ringing or buzzing sound inside their ear 24/7. It's just like the sound could be like something like ee or zh, or like this. It could be different sound. We call these symptoms is tinnitus. So when someone is having tinnitus, it means that their hearing pathway, one part of them might be having problem. Either it's the outer, middle, inner, or even to the nerve level. So when someone is having this like sudden pain, ear pain, or ear block sensation, this person might have the warning sign of hearing loss as well. And or even the worst one is they just suddenly lose one hearing totally. So when they lose one hearing or they lose two hearing together, this could be the signs that their brain may have acoustic neuroma, which is a tumor, just grow and then seated on the nerve, or they could be having some other issues which need to be addressed by ENT specialist doctor as soon as possible. So generally, this is a sign of hearing loss. But for those who are diabetic, we don't really have saying that they are sharing different signs. Uh, Generally, all the person who might have hearing loss, they are sharing or more or less this kind of sign. So you can also treat this 10 question as one of your guideline, whether or not self-check. You can tick on the screenshot, and then tick, see whether you score more than 3. If you score more than 3, then you might be having some hearing loss. So we recommend you do further hearing testing and then to find out more lah. And generally, sometimes people who can't hear, they don't know they can't hear. It's their friends or family or even colleagues are often the one who notice something is wrong. Hey, how come you always ask me repeat? Can you hear or not? Or when I say something, the person keep on misunderstand what I say. So this is how the person surround them notice the problem lah. Yeah. So yeah, this is the sign.
Wow. Yeah, so it's good that you as the audience because maybe you can like what Miss Alia say, you can self checklist yourself, see if you have those symptoms, or if you have a family member or friend or whoever colleague who has marked like have those check boxes, then maybe they do have those signs and they should get a hearing screening check. Okay, so now we already know the statistics, which is scary, and then now we know the biological relations. So let's move on to the preventative measures and lifestyle impact. Okay, so Dr. Andrew, can good blood sugar control help reduce the risk of hearing loss in diabetic patients?
Yes, I believe so, because the not only hearing loss but all the complications related to diabetes has got something to do with the blood sugar control. Therefore, when we have good blood sugar control, we can actually minimize the risk of all these complications. Therefore, getting a good blood sugar control is important. Of course, for us in Clinic Zero, we don't use medications, we don't use insulin, neither do we use any supplements to attain a good blood sugar control, because to us, that just don't work. It just don't work. Yeah, using medications to bring down the blood sugar, to me, will not prevent any of the complications, including hearing loss.
Okay.
Right.
Wow. So now I'm very curious how you treat your patients, but I'm sure you're going to save that for later. Yeah.
Yep.
So in that case, is it possible for diabetic patients to improve with lifestyle changes like diet and exercise?
Yes, diabetes is a dietary disease. Therefore, diabetes can only be reversed using a proper diet. It can never be reversed using any medications, any insulin, or any supplements for that matter. Okay, so to understand this part more, okay, so we now know that diabetes is associated with many complications, including hearing loss. So a regular doctor will always get their patient to take medication, right? They say, oh, because diabetes is associated with so many complications, so let's you know what? Let's take medication. Okay, please take your medications. Please take your insulin. Please take your supplements to bring it to actually prevent the complications. But the question is, do they? Do they actually prevent the complications? Yeah, and I think we kind of know that the answer is no, lah. Yeah, we know that many patients who are religiously taking all these medications, they still end up with complications. So we know that they actually don't prevent. Yeah, therefore we have to use the proper lifestyle method to actually bring down the sugar level.
Okay, so medications can only go so far, but actually the change in lifestyle actually plays a more important role.
I have a
Yes.
question here to Dr. Andrew, because just now you do mention that medications cannot really change a lot. It won't really reverse diabetes. It's more on control the diabetes condition, right? So, however, in my clinic, I also come across, and because so happen generally we would just ask, do the case history taking, and then we will just ask the patient, when is your hearing loss started, and then do you have any noise exposure history, or even what is your current medical condition. So a lot of them will say that, oh, I have diabetes, I have hypertension, I have high cholesterol, and then I will just ask them how you control them. They say, oh, I'm on these medications for 10 years already, very low dose. So far okay, so far okay. So so I just but based on what you have said earlier, is a little bit different from what the conventional doctor do. So but it can I say that actually when it is the diabetic condition is not serious, so maybe medication can help. But when the diabetes condition is very bad, even sometimes you have a lot of medication up to like maybe insulin level. We know that the insulin injection only needed when it's really medication can't help. I mean the general oral one can't help, then you will need the injection. Is that true that only the bad condition is like it is happening of what you have described earlier? Then the lighter symptoms maybe no? Just
All right.
wonder.
No, this is a very good and very relevant question. Okay.
Mm.
So a lot of people keep thinking that, oh, if my diabetes is mild, then probably, I just take some low dose medication and things like that, then complications will not happen to me.
Mm.
So we just take the case that you just mentioned just now.
Mm.
You met this patient. The very fact that she right, the very fact that she's telling you,
Mm.
that means there's already hearing loss, right?
Yeah.
Okay. So if the medication is so good for her to control the diabetes, right? Why is she having hearing loss?
But as I mentioned earlier, because the parents of hearing loss, aging is still one of the factors.
Aging is also one of it. Yes, yeah, that's right.
But
So
if let's say having diabetes is double the risk.
yeah, it doubles the risk, ma.
Yeah.
So it's like, okay, other than hearing loss, there's so many other complications, ma. You see, if the medications are good, why are the patients suffering from the complications? Why is there a stroke? Why is there a heart attack? Why is there kidney failure? Do you know that every 10 patients who go for dialysis, 7 of them are diabetic?
Really?
Every 10 patients who go for dialysis, 7 of them are diabetic. We are talking about 70% here,
Mm.
So if the medications are so good, they're helping the patients. Why is it the case?
Mm.
Okay.
Oh,
now,
just to let everyone know, dialysis is a treatment needed for those who had kidney failure.
that's right, kidney failure, where your kidney fail completely, and the only way for you to live on is either undergo a dialysis, or you have to go for a kidney transplant.
Mm.
Okay, coming back. So why are the medications not helping? Okay, frankly speaking, if you ask any diabetics out there, 80% of them will tell you that the medications don't work. They already know that it don't work, but most of them don't know why they don't work. And this is the part where I come in now. Imagine if you have rubbish in the kitchen. All right, where are you going to throw the rubbish? I'm going to give you 2 options now. Option 1, you're going to throw it outside your house. Outside your house, not neighbor's house. Okay, I'm not asking anybody to throw outside your house, waiting for the garbage truck to come. Option 2, you're going to throw it into your own guest room. Let's say you have a guest room in your house that is vacant most of the time. Okay, now I'm going to push this question to Natasha first. Where are you going to throw the rubbish?
Of
Outside?
course, the first option, the outside.
Obviously, right? I mean, this is like, I don't know, like, this is considered a stupid question now, right? Silly question, right? Okay, what about Alia? Where are you going to throw the rubbish to?
Same outside.
Obviously, right? This is like so obvious, right?
Yeah.
Now, let's come back to diabetes. There's a lot of sugar in the blood vessel, right? That's what we mentioned just now, right?
Yeah.
Doctors start prescribing medications, insulin and supplements, and they say this is to do what? This is to lower the blood sugar, which is true. They're not lying. None of the doctors are lying. None of these people who sell supplements, they are not lying. It's true. Anybody who takes this medication, they know very well that the moment they take the medicine, the sugar will drop. And there's a lot of magical supplements in the market. They say, oh, you take these supplements, the sugar will drop. It's true. Question: where's the sugar now? It has left the blood vessel. True. Where?
Is
Now,
it touching the urine?
Yeah.
one group of medication is passing through the urine. Only one group. That's called the SGLT2 inhibitor. SGLT2 inhibitor. One of the example is empagliflozin. Any medication that ends with gliflozin is that particular group. Only this group of medicine push the sugar out of the urine. What about the rest of the medication? What about insulin? What about most of the supplements? The sugar never left the body. It's still inside the body, just that it has gone to different parts of the body. So it's the same. It has gone to your ears, causing hearing loss. It has gone to your brain, causing stroke. It has gone to the heart, causing heart attack. It has gone to the kidney, causing kidney failure. So you see, most of the time, patients with diabetes who get hearing loss is sensory neural hearing loss, right? Why? Because how does diabetes destroy the nerves? It destroys the nerves by destroying the blood vessel. It is the blood vessel which is supplying the nerves. So when the blood vessels are destroyed, the nerves are not getting enough nutrients. That's where the nerves die. That's why in a diabetic, the most likely kind of hearing loss they will get is sensory neural hearing loss. Is the one that got nerves.
Ah,
Yeah, not the conductive one.
yeah.
Yeah.
Correct.
So now coming back just now, so we were saying that yeah, you can take medications for 10 years, 20 years. Yeah, your blood sugar is well controlled. My question to you is, so what? The rubbish never left you, ma. It's like you bring a guest to your house, right? And you proudly show them your kitchen. Wow, look, wow, Natasha, you see my kitchen is so clean, is it? But the guest will be thinking, yes, your kitchen is so clean, but how come it stinks? Where's the smell coming from? Actually, the smell is coming from your guest room because you have been throwing the rubbish into your guest room. So, ladies and gentlemen, if you are a diabetic and you are taking medication, if you have been doing it for the past 10 years, you have been throwing rubbish into your own body for the past 10 years. And this is the exact reason why medications, insulin, and supplements do not prevent the complications of diabetes, including hearing loss.
Wow. That's very mind blown.
Same to me also.
I believe any diabetics who know about this fact, right, the first thing you will want to do is, how can I reverse my diabetes as soon as possible? You know, understanding this fact, you will know that the medications not only do not prevent the complications, they actually draw the patient closer to the complication.
Closer, meaning is like even worse.
Correct.
Ever since they started the medications, then they are closer to the complications.
You think about it, it's simple, ma. The sugar is initially it's in the blood vessel, ma. Example, let's talk about hearing loss, lah. Now they push the sugar to the cochlea, lah, to the hearing organ. So it's causing damage there, ma.
Okay, but one thing what I learned last time in under this biology is like our blood, there is a blood flow, ma.
Yeah.
So there's a blood flow, then it will somehow bring the things, including like for example, the blood also bring the oxygen. Then it
Yes.
exchange with the carbon dioxide.
Yes.
And then after that it will just channel out. There's always one I forgot the name, is artery and veins, it's a different
Yes.
oxygen group.
Yeah.
One is oxygen, one is a carbon dioxide. So but the blood flow eventually will be circulate, and then after that there is something they can dispose the waste, right?
Yeah, they will dispose it in some way. So you see, many of these sugar, right? Okay, the problem is there's too much, ma. So the sugar still has to go somewhere, right? So now you're forcing it out of the blood vessel, so it has to go somewhere. It will go somewhere, lor. So another example, it goes to the liver. And in the liver, it is not really stored as sugar, you know. It is stored as fat. I'm pretty sure you have this thing called fatty liver, right?
Yes.
Yeah.
This is very common nowadays.
Yeah.
80 to 90% of diabetes suffer from fatty liver. It's actually coming from sugar. The fatty liver actually comes from sugar. It is not coming from fats. It's actually coming from sugar. So the sugar has got somewhere. It has to go somewhere. Okay. So other than taking that medication that can push it out, the rest of the medication just don't push it out. It's always within you. It's within the patient.
How long it will take the persons, after they have started the medications and then until the stage they probably had the complications like what you have mentioned earlier?
Okay. Frankly speaking, it should take very long. It should take very long because all these are very slowly, progressively kind of problem. But sometimes you realize that there are people who are not aware that they are diabetes, but they just got the complication first. Like they got a stroke, and then after that only they found out about the diabetes. Why? This one goes back to just now, no? Most diabetes go undetected. Yeah, it goes undetected. So you don't know, ma. So how you know? When something happened to you, you are forced to go to the hospital. Then when they check, how come your sugar is so high? You don't know, ma. So you actually don't know when the diabetes started in the patient. We don't know. That's why the annual check is very important.
Yeah.
So
Now I recall
if you want to have one, okay, I can give something that is more, how to say, if I put it in a time frame method, okay, one that I'm very sure of is this. kidney failure. There are altogether 5 stages of kidney disease. Stage 1, 2, 3, 4, 5. 5 is the last stage where patients have to undergo dialysis. From one stage to another, usually it takes 5 years. So by the time it ends, it's 25 years old, 20 to 25 years. This is the reason why most dialysis patients, right? Okay, most patients who undergo dialysis who are diabetic, right? They have already suffered from diabetes for the past 20 to 25 years. This is something that we can see clear cut. Another one that is very clear one is numbness. If any patient who comes in and say, oh, you know what, doctor, I have numbness, you can roughly estimate their diabetes at least 5 years or more already.
I see. All right. So coming back to this topic, because prevent like for me now, I don't have diabetes, Dr. Andrew. How can I prevent having diabetes in future? Is it I
Okay.
need to cut sugar, or what is the regular? I mean, generally, what is the sugar intake we are allowed to take without induce this diabetes?
Okay. So actually, sugar by itself, right, is not that bad. The problem is when we are not able to handle the sugar. All right. So to me, of course, I know the way to even reverse it. Therefore, prevention is even easier, Okay. So I take one example myself. Okay, myself. I'm not a diabetic. Okay, I'm not diabetic myself. So of course, I have to make sure I have to be a role model. I have to make sure that I'm not diabetic myself, right? Yeah. So what do I do myself? I do intermittent fasting. Okay. So the simplest form of intermittent fasting is 16-8. That means there's 16 hours of fasting where you don't eat anything, but of course you can still drink fluids like water, black coffee, or plain tea. Okay, so you hydrate yourself for the 16 hours, and then you give yourself 8 hours for you to eat. Usually, I get my patient to skip breakfast. Okay, because breakfast is the most important meal to skip. Breakfast is the most important meal to skip. Okay, so I get my patient to skip breakfast. Even myself, I skip breakfast, and then we'll go for lunch. We go for lunch at maybe about 12 noon. So the eating window is 8 hours, right? So it's 12 noon to 8 p.m. Meaning you will actually get your lunch at about 12, and then you take the dinner at about 7 plus. By the time you reach 8, you wrap up everything. So within the 8 hours window, you eat 2 meals. Let's forget about cutting off anything first, because trust me, cutting sugar is difficult. It's very difficult. Doing an intermittent fasting is way easier. So the concept behind intermittent fasting is we are giving our body an opportunity to burn off the extra sugar and fats. Yeah.
Okay.
So if you want to talk about preventive, for someone who has no diabetes, not on any long-term medication, to me, intermittent fasting is the best.
So shall we do this every day?
Yes, you can.
Wow.
Myself, okay. I'm not overweight, okay. I'm slightly muscular actually because I go for gym every week. Okay, I actually have a personal trainer for my for that. Okay, I do 3 days of 1 meal a day per week. 3 days, that means 3 days in a week I only eat 1 meal a day, and most of the time is dinner. I skip breakfast, I skip lunch. Then the remaining 3 to 4 days I will do 16-8. I take lunch and dinner. That's how I maintain my own health. This is me lah. It's personalized. Everyone is different. So yeah, this is for me. Yeah. But for me personally, I don't cut carbohydrates. I still take my rice, I still make noodle, pasta and everything. Yeah. Because I'm not diabetic. My body can handle the sugar.
So meaning for those diabetes patients, I will see that they say have to eat basmati rice because it's what lowest GI, right?
Lower GI, that's right. Yes.
So okay.
You want to know the actual answer for this?
Yeah, please discuss. I think our audience here is interested.
Taking basmati rice is complete rubbish.
Wow. Okay.
Complete rubbish.
So is it a marketing terms only?
Okay, think about it. Is there anyone that have successfully reversed their diabetes by taking basmati rice? Have you come across anyone?
No lah, I
No.
don't think there is someone reverse, but they always say that it's healthier. You know, my sister-in-law only have basmati rice at home.
But she's still taking her medication. Right? I don't know. Is she a
No, no,
diabetes or?
she's healthy. She's healthy. I think she's healthy, not on any medication. But it's generally, you know, how we are being. I know.
Yeah.
Programmed to believe it would help
Claims
us.
that, yeah.
This is the exact reason why there are so many diabetics out there. Okay,
Um,
let me put it in a simpler form for you lah. Huh? Let's talk about basmati rice. Okay.
mm,
Okay. One can of Coca-Cola, Coke lah, one can of Coke lah, contains 7 teaspoons of sugar.
Yeah.
Okay, that's one can of Coke. I'm talking about the normal Coke lah, maybe about 300 plus mils. Can y'all tell me how many teaspoons of sugar is there in one bowl of white rice? Pick a guess now. One can of Coke is 7. How many teaspoons of sugar is there in one bowl of rice?
15? 1-5?
Okay, very good, Natasha. You're very close. Actually, the answer is about 14 lah. Okay, 15 is also considered there lah. Huh? Some bowls are bigger and things like that, right? Okay, so that means it's double of a Coke. One bowl of white rice is double of Coke. Okay, now let's come back to basmati rice. Can you now pick a guess? How many teaspoons of sugar is there in one bowl of basmati rice?
it should be lower, maybe 12 or 10.
10 or 12. Okay, Natasha?
I'm gonna go with what Miss Alia said. 12?
No, the answer is the same. It's actually about 14, 15 as well. There's no difference. There is no difference. So now, I know what you are thinking now. Then what does it mean by low GI, right? Okay, you want to reverse your diabetes, you don't look at GI. You look at GL, glycemic load. Okay, let me explain. What is the difference between glycemic index and glycemic load? Almost everyone would have heard of GI, but hardly anybody hear about GL. Okay, so I will explain to you what does it mean. Let's take my hand now for example. Let's say this hand, this is my left hand, is a bowl of white rice. Okay, and this is when you take the white rice, sugar is going to spike like this. It's spike lah, right? Spike, Okay, my right hand now is basmati rice. Does it spike? Okay, watch the difference and tell me what's the difference now. Okay, in terms of GI, this is basmati rice has got low GI, right? Actually, this one also spike. It goes up like this.
Oh, it's just slower.
Exactly. Low GI means slow carbohydrates. It doesn't say lower carb. It's not low carb. It's slow carb only. So at the end, the same amount of sugar is released into the body. This is why you never see anybody taking brown rice, basmati rice, and successfully reversing their diabetes. They stay on as a diabetic.
So this includes brown rice as well.
Exactly. You never see anybody, any rice for that matter, even quinoa, even all this brown rice, whatever. So that's why, because it's still sugar, ma.
So what should we do? We should pick the food which is low GL, not
correct.
Not GI.
You want to reverse your diabetes? I'm talking about reversing. I'm not talking about like normal people like us. We are healthy. For us healthy people, we don't care GI, GL, whatever. We just do our intermittent fasting. That's good enough.
Okay.
For diabetic, you want to reverse your diabetes, you have to pick food with low GL. That means no matter how you eat the food, right, the sugar just won't spike because there's no sugar to begin with. So you want some examples of low GL food?
Yeah.
Eggs is very low GL food because eggs only contain what? Protein and fats. So eggs is very good. In fact, in our program, we mentioned specifically, if you don't take eggs, please don't join our program. There's no way we can help you to reverse. That's exactly how we actually share with our patient. Yeah, we give them a criteria. No eggs, don't join. Don't waste your time.
Wow. Okay. So vegan cannot join.
Pure vegan cannot join. Correct. Yes, vegan cannot join. I need my patient to at least take eggs. Even if they don't take meat, it's still fine, but they have to at least take eggs. If they are pure vegan, There is no way I can help them. No way. Literally no way. In fact, we have actually tried before. We actually had one patient, not under me, under Dr. Jasmine. The patient actually pleaded Dr. Jasmine to help her and make her as a guinea pig to try out for vegan case. Fail. Cannot make it. Really cannot make it. Because once you cut off the eggs, right, there's nothing much left really. In order to reverse that, there's nothing much left.
Okay. I just happened to see that there's a comment.
Hmm.
Someone had asked about what happened if we have gastric, then we skip morning meals. I think that's valid because I
Yeah.
myself, I still okay to skip once in a while, but yeah, want to hear from you, Dr. Andrew.
Yeah. Very common question. First of all, let me have let me give you a big picture of gastric first. We have many patients who suffer from very serious gastric. So serious that the doctor, right, the specialist, right, told the patient, you must eat the gastric medication every single day without fail.
Wow.
Without fail, this is so bad. This is how bad it is. I don't know whether you come across patients like this or what, but I come across patients like this. They have to take gastric medicine every day. Whether got symptom or not, they still have to take one. Yeah? After joining our program, I put them on 47 hours fast. No gastric.
Wow.
No gastric, the medication also switched off already. Okay, so now the next question that we need to ask is how come? How come when our patients skip all the meals so many hours some more, how come no gastric? Alright, you're curious, right?
Yeah.
Okay, the next question we need to ask is this. When we have gastric, right? When we suffer from gastric and we go to the doctors, what do regular doctors advise the patient? Okay, some of you can start typing the question, the answer in the comment box. Okay, when you have gastric and when you go and see the doctor, what are the common advice given to you? Okay, so while waiting for the answers from the comment, we will ask Natasha now. Natasha, I don't know whether you are familiar or not. What kind of advice is given? Do you know for people with gastric?
Usually like don't skip meal and you have to eat the meal before you take the medication kind of thing, right?
Okay, all right, yeah. So don't skip meals lah. They ask you to go for like small frequent meals kind of thing, right?
Yeah, small portions, like eat 6 times
Correct.
a day like that. Yeah.
Exactly. Okay, so this is one. Okay, Alia, you know it's your turn, right? So
Yeah,
what are the common?
I recall is like the doctor say, yeah, you don't skip meal, you eat on time. Train your I mean, if you want to eat lunch at 12, then you eat at 12 or at most at 1. Don't delay until like 2. So
Okay.
you have to be on time lah. I recall that.
Okay, all right. So that means kind of like same answer lah, both of you same answer lah, So that means don't skip meals lah. Okay, some of the doctors will tell you don't eat spicy food lah.
Oh,
Alright.
yes.
Yeah,
some
those
of them
are
will say,
bloated. Don't eat.
correct. Like don't know lah. Some of them will tell you say that maybe alcohol to a certain extent, alcohol also can cause, coffee also can cause, and all this lah. Okay, now after hearing all this advice from these regular doctors, right? Does the gastric recover? Do you think the patient recover fully from the gastric, or they still get it once in a while?
They still get it once in a while.
Wow.
Patients never recover. Question.
Yeah.
Why? We cannot be saying that the doctors are lousy, right? We have to say that the doctors are good, right? Doctors have good intention for the patient. But how come the patient still suffer?
Is it because it only fixes the problem for that time being only, but it doesn't fix the overall problem in the long
You're right.
run?
Yes. Okay. The question that we need to ask ourselves is this. What is the root cause of gastric? Root cause. ROOT. Root cause. Okay. So what is the root cause of gastric? Gastric, the medical term for it is gastritis. Okay? We all know that anything that has got an itis at the back, right? ITIS, itis means inflammation. Okay, give an example. Dermatitis, skin inflammation. Conjunctivitis, right? The inflammation of the conjunctiva. tonsillitis, okay, the inflammation of the tonsil. Gastritis is the inflammation of the stomach wall.
Today only I know.
Okay, no, yeah, this is how doctor make themselves look smart by going adding all this term. This is how it is lah. Actually, doctor not very smart one
I
lah.
just remember all the names is very hard to remember sometimes.
Okay, so
Okay.
what causes the inflammation of the stomach? One word only. My
I
favorite
thought
word.
it's too much of the gastric. No, too much of the acid.
Yeah, the juice, right? You're saying too much of that, right?
Yeah.
Stomach acid.
That one is still a after effect. It's still not the root cause yet.
I don't know.
The root cause
Audience,
is
do you know?
yeah. Whether anyone can guess or not. The answer is sugar. Remember just now I mentioned sugar causes inflammation of the blood vessel wall? Right? Wherever the sugar goes, it will cause inflammation. It goes to the cochlea, it causes inflammation there. It damages the hearing the hearing organ. So too much sugar also causes inflammation over the stomach wall. How many of you notice? How many of you notice? When you eat potatoes, right? What happened?
You tend to pass the gas more often.
Correct. You are more bloated.
Yeah.
Yes. All this carbohydrate stuff, starchy stuff, sugary stuff. These are all called as sugary stuff. They are the one causing the problem. So, if you suffer from gastric, you want to recover completely from it without using any medications or supplements, the first thing you need to cut off from your diet is sugar. And I'm not talking about sugar. I'm talking about carbohydrates. I'm talking about rice, noodle, pasta, kueh, cakes, you name it. All the carbohydrate stuff. You cut that one first, then only you start skipping meals. There's a sequence to it. So for me, I don't have gastric. I can fast as I wish. I have come to a state. I'm very flexible one. I want to eat, I can eat. I don't want to eat, I'm not going to die. I'm still going to be normal because I have trained my body to be flexible. I travel a lot. I travel on a monthly basis overseas. So whenever I travel, I eat lor. I will go and enjoy the hotel breakfast or I go out and eat whatever. When I'm at home, I can skip breakfast, I can skip lunch, I can only take dinner. Like today, example, I had my dinner at 5 o'clock just now, 5 plus. That's my only meal. No breakfast, no lunch. So if you have gastric, the first thing you need to do is cut carbo, get used to that one, then only you start doing intermittent fasting.
Very thank you for the tips. Oh, there's a questions again.
Yeah, we got 2 questions.
I
The
think this
first
is about
one,
the eggs. Yeah, I think
yeah,
this one.
the eggs. How many eggs can one take daily? 1.
100.
100 eggs.
Ask any of my patients. We have almost 1,000. We have more than 1,800 patients. This is exactly what we tell our patients. There's no limit when it comes to eggs. No limit. And I know what you're thinking now. High cholesterol, ma.
Yes, exactly. You're reading my mind.
Doctor,
I read
ask my
online,
dad
they
not
say
to
like
take the egg
6
yolk.
eggs.
What if I were to tell you, the higher your cholesterol, the longer you live? Do you know that there's a clinical study done on 200 countries, right? Okay, 200 countries. I'm not talking about 2 countries. 200 countries that states the higher the cholesterol, the longer you live. The lower the cholesterol, the faster you die.
Is Malaysia
What
part
kind
of
of cholesterol
the
first? We have the good and the bad one.
What if I tell you that there's no such thing called as the bad cholesterol? I know you're thinking about LDL now. LDL, the bad cholesterol. No, LDL is what we call the other good cholesterol.
Wow.
Think about it now. Okay, I know this is going to be never ending. If I start talking about this, it's going to be never ending. Okay, but I want to put it in a very simple analogy for you. Have you come across patients or your friends who suffer heart attack before?
Yes.
Heart attack, Okay. Okay, what is the chances of a heart attack survivor getting another heart attack? Is it high?
Yes.
I think so, yeah.
Okay, I repeat the question. What is the chances of a heart attack survivor getting a second heart attack? Is it high or low?
Hi.
High lah. Correct. It's high. You yourself know it's high. Why?
Okay.
Why I ask this question? Why? You think about it now. Okay, the patient survived the heart attack. Okay, that means now the patient is probably under close supervision of a cardiologist, right?
Yes.
I'm pretty sure the cardiologist is kind enough to optimize all the treatment, right? All the medication, lowering the cholesterol, give blood thinner, everything, whatever can be done will be done, lah, right?
Yes.
Or do
Yes.
some procedure, stenting, bypass, whatever, lah. Okay,
Uh-huh.
to try to prevent the next heart attack, right?
Yes.
How come the incidence of second heart attack is high? Have you know where I'm getting to now?
It's from the food they eat.
Where is it from? So you see, if the doctor is good, by right, they should be able to prevent the second heart attack, right? Doctor should be good enough to do that, right? Why is it not preventing? Because heart attack has got nothing to do with cholesterol.
Oh, okay, I see. It's based on the sugar, based on the blockage.
Correct. It has got nothing to do with cholesterol. Someone already mentioned, who is this? Yeah, Tang Lai Sing. It's due to the inflammation in the blood vessel wall.
Hmm.
The cholesterol is innocent. Okay, let me explain this part a little bit to you now. What do I mean by innocent? Now, actually, to be fair, right, when they do an autopsy on a patient with heart attack, they cut open the heart, right? They cut open the blood vessel. They actually see cholesterol there one. They saw the blockage there one. It's true. They actually saw the blockage there. The only question is they forgot to ask, why is the cholesterol there? They forgot to ask this question. They only thought, cholesterol is there means cholesterol is a bad guy. But they forgotten to ask, why is cholesterol there in the first place?
I thought all the
There's a
cholesterol
different
is from the
mastermind.
Huh?
There's
Not
a
from the
different
food.
mastermind. Yeah.
No, let's not talk about whether it's from the food or not. That one also another story. Why is the cholesterol in the blood vessel in the first place? Why is it there? Okay, let me share with you. Actually, cholesterol went there to patch up some injury. There's some injury over the blood vessel wall. There's some inflammation going on. It's injured already. The blood vessel wall is injured. The cholesterol went there to do patching. Went there to lekat.
Okay.
Okay. So now the next question we need to ask ourselves is, what is causing the inflammation over the blood vessel wall?
Sugar lah.
Sugar again, it goes back to sugar again. This is why a diabetic, right? The risk of them getting a heart attack is 2 to 3 times higher than a normal person. Okay. So if you don't understand this analogy, I will explain using another method, which someone already mentioned in the comment box, firefighters. Okay, now imagine if you see a house burning in front of you. Okay. And then you see firefighters around the place trying to put off the fire. Would you say, bloody hell, all these firefighters are nonsense and go and start the fire for the house? Would you say that?
No.
No,
Yes.
you're gonna say, thank you, Mr. Fireman. You are here to actually put out the fire, correct? And then you'll be thinking, who in the world went and start the fire, right?
Yes.
You must be scratching your head, who is the culprit? Who went and start the fire, right?
Yeah.
Cholesterol present in the heart attack is exactly the same. Cholesterol is the firefighter. They went and patch up the injury. It's the sugar that causes the problem. Now, let's come back to just now, the second heart attack. So when a heart attack survivor, okay, they survive the case. Okay, when someone survive a heart attack, right? Doctor lower the cholesterol. But the doctor never stopped the patient from taking sugar. The doctor still asked the patient to eat what? Eat oats in the morning. Eat brown rice, basmati rice. Eat this wholemeal bread. Eat lots of fruits and vegetables, which is all sugar. Hello, you're still asking the patient to eat sugar. The inflammation is still happening. You lower the cholesterol, so what?
Oh. Okay.
You want to talk about cholesterol, right? Another one, I give a simple example. Let's say you take your sugar lah, you take your blood lah, and the cholesterol level come back as 5.0. 5.0, okay. You pick a guess, how many percent of the 5.0 come from your own body, and how many percent come from food?
Don't know.
Total up is 100%, okay, 5.0 total lah. You pick a guess, how much actually come from your food? Just answer this. How much actually come from food? The total cholesterol, let's say, is 5.0. How much of it actually come from food?
3.
3.0 out of 5. That means 60% come from food lah.
Yeah.
Natasha, you want to try?
20.
20%.
Yeah.
Bingo. It's 20%.
嗯
20% of your total cholesterol come from food. 80% of it come from your own liver. Think about it, simple only. By right, vegan, strict vegan, who don't take eggs, supposed to be, their cholesterol level supposed to be 0, right? Because everybody keeps saying that the cholesterol is due to your food, So if you're vegan don't take any animal products, right? There shouldn't be any cholesterol. Because cholesterol only come from animal. There is no cholesterol in plant-based food one. No cholesterol at all. The cholesterol one, they got a different name. I suddenly cannot remember the name, but it's not called cholesterol. Their fat is they got a different name for their fats. Cholesterol only come from animal. Okay, so if you think about it, right? Vegan who don't even take eggs, because eggs got cholesterol, So if you are vegan who don't take eggs, your cholesterol is supposed to be 0, if all the cholesterol actually come from food. But the question is no, Actually, vegan also got high cholesterol, because the cholesterol come from your own body. If you take 0 cholesterol from your food, your body still produces 3 grams of cholesterol every single day. 3 grams. Your body will produce itself. Why? Because it is so important for our health. That's why our body decided to produce it on its own.
I suddenly realized that cholesterol has been actually being like, how to say, in Chinese we call 很冤枉
Correct. Yeah.
It's like misunderstood by the public,
Correct. Cholesterol is so innocent. Cholesterol is demonized for nothing, and everybody keep thinking that sugar is good. So everybody keep taking sugar. Everybody is taking sugar. Brown rice, basmati rice, what else? Oats. You take cornflakes, you take fruits. Fruits is so bad, actually, especially fruit juices. They go and drink milk, which is also another form of sugar. All these are sugar. All the flour products, yeah. Actually, the main culprit is sugar. It's not fats. This is why we have been practicing low-fat diet, right? All this while, everybody has been talking about low-fat, right? But is the population getting thinner or getting fatter?
Fatter.
Correct. The lesser fat you eat, the fatter you become. The more fat you eat, the thinner you become. My patient only go for high-fat food. When they take high-fat food, right, my patient can lose weight up to 50 kg per year. 50.
Wow.
50 a year.
It's impressive.
You don't have to trust what I say. Go to our Google review. Check out our clinic. You just click Clinic Zero. Go under our Google review. You will find 400 over reviews, and we score 4.9 out of 5 stars in our Google. And some of them will be writing their weight loss journey. You can actually, and we ask them to eat high-fat food.
Wow. Okay, that's very.
Yeah.
Yeah, that is very
For those who want to slim down.
You want to slim down, take fatty food. Take KFC.
Wow.
Go for those fatty bacon, fatty pork for non-Muslim. Go ahead. This is how we advise our patient to eat. They take lots of fatty meat, then they lose weight.
But remember, our audience, again, you must also refer to a specialist like Dr. Andrew to guide you properly. Don't like simply take a lot and not really fasting and things like that. Then it will give more complications, right?
Okay, disclaimer, whatever advice that is given here is only meant for those who are not taking medications. If you are taking any long-term medications, be it for the diabetes, be it for hypertension, please don't do whatever that is being advised just now. Because I can assure you, you are going to end up in ICU the very next day. Because your sugar is going to crash, your blood pressure is going to crash. And you're going to end up in ICU not even knowing what actually happened. Yeah, so we know exactly what needs to be done. So we actually customize the meal plan according to each patient. We know exactly when to drop which medication. We know how to taper off the medication safely for our patients who are on medications, of course.
Right. So kids, don't try this at home.
Yeah, this is really this is not a joke. Yeah.
Yeah.
Okay. I think
Okay,
we
so-
move to the next topic lah. Next section.
Okay.
But thank
Yeah.
you so much for and Dr. Andrew for actually disclose the tips to really reverse diabetes or even to prevent diabetes. I think as a healthy person, I also learn a lot, and to be honest, I love sugar very much. I can think of for morning, basically for my breakfast, then my lunch noodles, then after that my dinner is a pasta noodles again. So once in a while I still take chocolates at night and also the cakes.
Okay.
Yeah.
Truth to be told, I'm also like this. I'm still in love with my sugar. I'm in love with my snacks. You know, when you travel a lot, you tend to buy a lot of all these tidbits and everywhere from whichever country, right?
Yeah.
You can still enjoy all these, provided you do fasting.
So meaning when you don't travel, you really limit yourself. But I just wonder because just now when you mentioned you only ate one meal a day, like just for example today, right? You just had your dinner at 5. Don't you feel hungry in the morning?
Initially, yes, but now I got used to it.
So you
Okay.
can really literally
Talking
just
about-
like tahan the
No,
hunger and
actually,
you don't really feel gastric or anything like bloated, anything.
I have done this for so many years. Why would I continue if I suffer from bloatedness or gastric? Why should I suffer, right? I don't want to suffer, right? Of course, I don't want to cause any disease to myself, right? Okay.
Yeah.
So just now you asked, you were talking about hunger.
Mm.
I don't know how many of you still remember when we are young, right? When we were young, is it easy to take breakfast or not? Is it
No.
easy or is it tough? Like it's like, no appetite lah. I'm still like very sleepy. I don't want to take breakfast. Is it easy or is it tough to take breakfast?
I don't usually take breakfast.
Okay, so Natasha don't usually take breakfast. Why? Breakfast is important, you know, you must eat.
Didn't you just say the opposite just now?
Yeah, I know, but now I'm teasing you. Everybody says breakfast is important, so why are you not taking now? So no, you tell me from your perspective, why are you not taking? Is it because you got no appetite or what is happening? Let's share.
It makes me feel sleepier. If I take
Got it?
breakfast in the morning, I feel more energized if I don't take breakfast. I feel more energized all the way until lunchtime. Then only I need like that extra energy. Then I take lunch lah.
Okay, what time is your lunch?
Lunchtime, 1 o'clock.
1 o'clock. Okay, so that means can I safely say that by the time it comes to around 1 o'clock, the hunger pangs come in already. That means you actually have the hunger signal that you want to eat, correct?
Yeah.
Do you know why? It's all about the
Is it our biological?
Yes, it's all the biology. How come my patients can skip breakfast? I can tell you more than 90% of our patients skip breakfast. And hardly anybody gets gastric. Okay, coming back to the hunger thing. Actually, when the word breakfast is being coined, right? Breakfast, it doesn't say it's morning, you know. There is no definition of morning inside that particular word. It only say breakfast, ma. You are breaking a fast. It doesn't say morning, ma. Who says it needs to be morning? No, nobody says that. Do you know who is the one advising us to take breakfast? Breakfast is only good for you if you are the one selling breakfast. Okay, now coming back, it's not easy to take breakfast for at least for Natasha. Okay, for Alia, is it easy or difficult for you to take breakfast?
I think nowadays, in the morning I will take some breakfast, but I don't like to have heavy breakfast. Because
How
I
come?
can see some of them, I mean, they don't mind to have breakfast like noodle, curry mee, or like even wonton mee. To
Heavy one,
me, it's
right?
heavy.
No, leh. Actually, that one is correct, leh. Because remember, they always say, you must eat breakfast like a
King.
correct. You must eat breakfast like a king. You eat dinner like a beggar, ma. So
Yeah.
actually, eating heavy is correct. It's
But not for
completely
me.
wrong. It's
I can't.
completely wrong. Yeah.
Okay.
Let me share with you. There's a biological process in our body called the dawn phenomenon. DAWN, dawn phenomenon. Means this happened in the morning from 5 a.m. to 8 a.m. whereby our liver is actually producing sugar on its own. And it's actually pouring the sugar into your blood vessel. And at the same time, it is actually suppressing your appetite. This is the reason why it's a bit difficult for you to have heavy breakfast in the morning, or sometimes you don't even feel like eating. It's not your fault, it's biological. Naturally, it works this way. That's why it's not easy to actually force kids to eat breakfast. Not easy because naturally they don't have appetite one. Because this is natural, the sugar is already high. So by the time it reaches, actually most of the time not 1 o'clock lah. If you notice, if you wake up late in the weekend, most of the time you will start getting the hunger pangs around 11, 12.
Yeah.
Because by the time you reach that time, right, all the sugar has been burned off already.
Mm.
So it's actually very natural to skip breakfast. Yeah. And just now remember, Natasha mentioned something. With the breakfast, Natasha will feel sleepy, correct?
Yeah.
I thought they say must eat then only got energy one. How come now the reverse is happening? That means are we saying Natasha is abnormal? Natasha is completely normal. Will give you another example now. Let's say there are two tigers going for a race. Racing, tigers going racing. Tiger A is now hungry. Tiger B just had a meal. Okay, and their meal is obviously big. They just had one big meal. Which one do you think will win the race? Tiger A, the hungry one, or Tiger B, the one that just finished a meal?
Tiger A.
Yeah, the hungry one.
Because they
no.
are hungry, so it's rushing.
How come everybody say you must eat and you must carbo load then only go for exercise How come now suddenly the hungry one can run faster? Let me explain to you why. So actually Tiger A is Natasha lor. Natasha is hungry and she's actually energetic. What is the reason behind? All of us know every time after we eat, what happens? We feel like
Sleepy.
Sleeping.
food coma, right? There's even a proper term called food coma. Why are we sleepy after food? Because our body needs a lot of energy to digest the food. So a lot of blood will actually flow to the digestive system to digest the food. So when this happens, less blood will flow to your brain. That's when you actually feel a bit brain fog, and then you feel like drowsy and But imagine when you don't eat. So no blood flow is required to digest food. And then some more, our body, we got reserve, right? Our body will start using the reserve. That's why you're super energetic when you are actually fasting. The reason why I don't take breakfast and lunch during my working days is because I want to make sure I'm alert. Okay, because my kind of job is consultation work, right? Okay, I talk a lot, right? I keep talking non-stop, right? To my patient also the same, because I only do online consultation. So I'm sitting in front of them every day and I need a lot of my brain juice. So I cannot be like drowsy in front of the patient, right? Then I give all the wrong prescription and everything, right? So that's why I fast. When I fast, I got more energy. I can think clearly. I save money. I save time. And most importantly, I maintain my health.
Then do you have enough calorie?
Okay.
Because
To be fair,
there is something called calorie deficit when people want to slim down.
Okay.
So
Your-
you cut down to only one meal.
Okay. Calorie deficit is actually based on your BMI.
Yes.
If your BMI is lesser than, okay, let's think about this way. Only when your BMI is lesser than 16, 16, then you will actually go into calorie deficit, whereby you got nothing else to burn. Okay, so of course we try to maintain the BMI between 18.5 to 23. You're talking about Malaysian standard lah, huh? We don't want to talk about those European countries where their BMI is more than 25. Ours is actually up to 23 only. So as long as you are not like until 16, right, BMI of 16, which is very low, you will always have extra reserve in your body to burn. That means your body will not burn muscle. It will still be burning fats and sugar. Yeah, so we don't have to worry about calorie deficit. Yeah, we are not like thin until left with bones, right? We are not that way. Yeah, of course, if you are that way, then that one is no more called fasting. Right? That one is actually called what is another word?
Anorexia, is it?
That one is called starvation. Right? Starvation.
Mm.
That means you are so poor, you got no food to eat, and you are literally left with bones. Your body is burning muscle already. Okay, a lot of people say, "Ah, yeah, cannot lah. I start fasting, my body will burn muscle." No, this is almost completely wrong. I give you an example. Let's say we are living in a winter country. Okay, so winter is coming. It's November, December, right? Okay, and let's say you have some furniture in your house, and you also have got a lot of goods. Okay, are you going to use the wood, or are you going to use the furniture to start a fire for the fireplace? Okay, Natasha, which one? You're going to use the woods, or are you going to use the furniture? Are you going to burn the furniture? Extra woods.
The woods, of course.
Of course, right? You're going to burn the woods, right? Who in the world going to burn the furniture? At what point you will start burning the furniture?
If I'm
When the
desperate,
woods finish.
Correct. When your woods finish, you are desperate to generate heat, then only you start burning furniture. Our body is exactly the same. Unless you are really underweight, your BMI go lesser than 16, your body got nothing else to burn, that's when it will start burning muscle, the proteins. Beyond that, your body will always be burning what first? Your body will always be burning sugar first, followed by fats. This is the sequence. Your body always love to burn sugar, followed by fats, and then followed by protein. Protein is the last one.
Okay. All right. Thank you so much, Dr. Andrew. That was very insightful. We'll have to move on to the next topic, which is the screening and diagnostic tests for diabetic patients. So, Dr. Andrew, are there specific tests or screening you recommend for diabetic patients?
Okay, the one that everybody knows is HbA1c. Okay, that one is actually the 3 months average lah. So the moment it crossed 5.7%, then something is wrong. Okay, I don't want to go into the details. However, just by testing the HbA1c is not enough.
Doctor, that test is from blood test, is it?
Yeah, just a normal lab test will do. Any lab can do one. Very basic, very simple. HbA1c.
HbA1c.
In Clinic Zero, we don't only check HbA1c. We also check the insulin level for our patients. And I can assure you, 99% of doctors do not know what is this. And they don't even test for the patient because they also don't know how to interpret. Yeah, but for us, we check insulin level. Why? Because we want to know whether the patient is suffering from insulin resistance or not. Because insulin resistance is the root cause. So how do you find out whether patient got insulin resistance or not? It's by checking the insulin level. So for us, in Clinic Zero, our patients, we will actually help them to check their insulin level, which is also just a lab test only. But it's a bit expensive. That test alone will cost about 200. But it's important. It's important because we will find out whether the diabetes is the reversible type or not the reversible type.
Okay, that's
Meaning there is some diabetes can be reversible, but there's some cannot.
Correct.
So
yeah.
Okay.
Interesting.
You have come across, I'm pretty sure you have come across some patients who are, some of your friends who are on insulin, right?
Yes.
Okay. If you want to give insulin to somebody, The first thing that you should be doing is checking the insulin level first, right? You want to check the existing insulin level. If there's not enough, then only you give insulin, right?
Mm.
Okay, but this is logical. Logically speaking, it should be this way, right? 99% of doctors prescribe insulin to their patients without checking their insulin level first.
Isn't that dangerous?
Yes, it is dangerous, but this is exactly what they're doing, and this is in a standard guideline, so they don't have to worry about the enforcement officer coming to check on them or whatever, because this is the standard guideline. The standard guideline do not require them to check the insulin level before prescribing insulin to the patients. So I have many patients under our care, right? They come in, we help them to switch off the insulin. Okay, initially they are taking insulin, then we switch it off for them. Then after some time, okay, I let the thing cool down first, and then I ask them to go and check the insulin level. Then when the result come back, right, then they are shocked. Hey, how come I got insulin one? That means actually all this while, let's say they've been injecting insulin for the past 10 years, they actually don't have to inject.
Oh,
They have been literally conned by their doctors. I tell them, look, okay, this is your own lab test report. You went to your own lab. You didn't come to my place. I don't own a lab, by the way. Okay. So I just proved to you that your body is still producing insulin. So for the past 10 years, you've been injecting insulin for nothing.
I thought because if they not injecting, then they will be dying.
No, it's because they're injecting. That's why they're dying. Remember just now I said the medication is drawing you closer to your complication. The insulin is pushing the sugar to the end organs,
Okay.
For type 2, type 1, that one, of course, they have to take insulin. That one, nothing to do. That one, they have to take insulin. For type 1, they have to take insulin.
All right, so let's move on. Miss Alia, is there any screening hearing tests for diabetic patient or any patient who may be at risk for hearing loss?
Okay. So over here, I prepare one interesting sound that you yourself can just play it. Not play. I mean, you just listen to it. But if let's say at one point the digit there will show, and then you stop hearing the sound afterwards, please put the number in the comment box. Okay. So Anis, please help me to play the sound. So this is a frequency test where we were playing the sound. Will be get a bit louder over here. So Natasha, at what sound you can't hear?
Of course, from between 20 and I think 55 or 50.
Okay. Afterwards?
Afterwards, I could hear it very loud, so I had to lower down the volume.
Okay. But can you hear it until 20,000 hertz?
Oh, 20,000. Yes, I could.
You could. Wow. Meaning to say you have very good hearing. How about you, Dr. Drew?
The beginning part I kind of miss out. The later part I can only hear up to about maybe 15K.
Yeah. Same goes to me. I can hear up to around 15K. So which means that we probably have some ultra high frequency hearing loss.
Okay.
But this is normal because in audiology, we only tested the hearing loss from 250 hertz up to 8,000 hertz because this is the sound which is crucial for our speech level, for conversation, and then for you to learn the alphabet, the phonetic, English phonetic, R, E, sh, and then all this. These are the sound. It's fine. No need to play again, Anis. So over here, there are some people. Why I put it this? Actually, this is not a proper hearing test. A proper hearing test, we are using the headphone, all right, and then you need to done it in the proper quiet room, a sound treated room,
and then we will play the different tone, pure tone. And then once you hear it, you can press the button and then let us know. And from there, we were testing from the louder volume, then go down to the lower volume, or we call it inaudible volume that you can't hear. Then after that, we will increase back again. So this is how we find the threshold. So over here, there's some people saying that, oh, I can only hear up to 2000, which means that for you, you probably had high frequency hearing loss because all of us is having the same. So, generally, if you are healthy, you should be hearing more than 8,000 hertz lah. Of course, this 8,000 hertz is just is still at a higher volume. But if let's say in the hearing, in our test, we will test it to the lowest one and then we will find out what is the volume. Only the threshold between negative 10 to 20 dB, the person is considered having normal hearing. Okay, so earlier on, Natasha, this test is, I only do this when I'm having the talk because it's one time I can screen everyone. So for those who couldn't get you can't hear up to 8 or 10,000 hertz, I recommend you to do hearing test. Otherwise, later in the comment box, we will also paste one particular link. This is a Soundlife online hearing test. You can do it at home. Just make sure your door and also window is closed, and then your aircon is at the low fan, and then your fan is turned off, and then just test it for 5 to 10 minutes. If you get a green result, congratulations. Maybe from the screening your hearing is okay, but if you get the yet red or yellow colors, which means that you might be at risk of hearing loss, then we recommend you make a appointment with us to do a proper diagnostic hearing test. And remember, just now I share also the screening questions. Over here, can you show? I would like to show to the team. This is a 10 screening questions. Okay, so if let's say these questions out of so many, you can score 3 out of 10. Above 3 out of 10, which means that you already have the sign of hearing loss, then which also means that you don't pass the hearing screening. So normally in audiology, we either do the screening via questionnaire, which is something like this, or we do the screening via the proper device lah. But nowadays with the technology, we can actually leverage lah. Yeah.
Okay, thank you so much for that, Ms. Alia. So now we'll be moving on to the topic of treatment and management of diabetes and hearing loss in diabetic patients. So just now, Dr. Andrew did leaked out a bit on how he treats his patients, which is taking egg and also intermittent fasting. But is there like any other methods you use also, doctor, to treat diabetes compared to the conventional way of treatment?
I would say that the management of diabetes, there's actually two aspects to it. I will put it as 50-50. So 50% is actually the dietary management. Okay, so where the proper diet with the right food, okay, right type of food to be taken by the patients. So you have to cut off, of course, the carbohydrates, and then you have to start taking more of the meat, the eggs, tofu, vegetables, and things like that. Okay, actually, not so much vegetables lah, because vegetables contain very minimal amount of nutrients. So, and then of course, plus the intermittent fasting. Okay, so this is one part. Then the other 50% is actually the management of the dosage of medication, how to taper them off, okay, which medication to get rid of first. In terms of insulin, let's say a patient comes with 100 units of insulin per day, how much should we drop, okay, and which one should we drop first? Yeah, so these two has to go concurrently. All right, so this is why we always tell our patients, right, if you have like you are taking medications and all this, please don't do this at home because it's so dangerous. I give a simple example. The basic form of intermittent fasting is 16-8. That's the most basic form. There's nothing lesser than that actually. 16.8. That means you have to fast 16 years for you to see certain results. 16.8. You plus these two number equals to 24 hours, right? If you are taking diabetic medications, most of them require you to take twice a day. Twice a day means 12 hourly apart. Can you see it clashes now? One is 16.8, the other one is 12 hours. Question, how are you going to do fasting when you are still taking medication? The answer is you can't. Because if you start with that, at certain point of time, right, the dosage, the effect of the medication will overlap. So there will be certain time that your sugar will be too high, there will be certain time that your sugar will be too low. Because the effect of medication only run for about 12 hours in the body. Any medication that you need to take twice a day means the effect is only 12 hours. This is why you need professionals to help you. We do this concurrently. We know exactly which medicine. Once we drop the medication, we know what to do next. Like, okay, once we drop this medicine, we can do intermittent fasting. Okay, because otherwise you really land up with problem. A lot of people will say, they'll say, hey, cannot lah. My doctor say I must eat every single meal one. Otherwise, I go into hypo, my sugar will be too low. Of course, lah, you're taking medication, you don't eat, of course, your sugar will be too low. That's why it's two parts, two aspects. Managing the diet and at the same time managing the medication. So it's two aspects, and it's very much individualized because everyone is different. There is no like one size fit all kind of diet. Oh, everybody just eat like that, you can reverse your diabetes. No, it doesn't work that way because everyone is different.
Okay, thank you so much for that, Dr. Andrew. So, because your methods has been very effective for your patients, could you share with us about your success story in reversing diabetes?
So many lah. Okay, the longest diabetes we have ever reversed is someone who suffered from diabetes for 36 years. The patient is 72 years old. He has been a diabetic since 36 years old. So after 36 years of diabetes, he came to us with like 98 units of insulin per day and with a few more medications. We reversed the entire disease within 6 months. That means we drop off all the medication, the insulin, the supplements, and his HbA1c normalized. It came down to normal, lesser than 5.7%. All these natural. No medications at all, no insulin at all, no supplements. This case has been actually published in Guangming Daily, one of the newspaper. And of course, if you start doing Google review of us, you will find lots more testimony, live testimony of our patients where they write their feedback on our reviews. You can also look for our YouTube channel, Clinic Zero Internet, Clinic Zero. You can find, we also have lots of all these testimonial videos that are being recorded. So generally, our success rate is about 80%.
I see. So you've also prepared one testimonial video for us to watch by Dr. Safura, one of your patients, right?
Yeah.
Doctor,
okay.
and
Yeah.
I want to
Please help me to
mention
do.
this, that I've seen so many failures during my service. I think this is one approach that put me in this belief that it can be done. You know, and I think with proper counseling from Dr. Andrew and I'm sure from Dr. Jasmine, from a team, you need actually personal counseling and you need that motivation to go on, you know, to keep your target as your destination. I think without counseling, without guidance, yes, you can get astray and failures. So I think my message is reverse diabetes is real and it can happen to it can be done by many and it can be achieved by many. Thank you.
Wow, thank you so much.
That's amazing. You can hear it from another doctor.
Yes,
Dr.
Safura is the top 5 medical doctor in Malaysia. Top 5.
Wow.
Yeah. 2 years ago, she retired from the Ministry of Health and she's actually the head of department for the Public Health Malaysia. So why is she appearing on this video? Is because she's actually my patient. I helped her to reverse her diabetes and hypertension in only 2 months' time. And that is why she's willing to share that testimony just now. Yeah, so I always believe that if a high-ranking medical doctor can put away her ego and do this, any one of you can.
There you have it, audience. This is why Dr. Andrew is different than the conventional doctor, because even conventional doctor also go look for him for this treatment. Okay, so moving on, Miss Alia, if a diabetic patient does have hearing loss, are there treatment options specifically suited for them? Oh, I think you're muted, Miss Alia.
All right, so sorry. Yes, there is a solution. So the solution is using hearing aids. If let's say their hearing loss is not due to conductive hearing loss, the type is sensorineural or mixed hearing loss, which these two means that the hearing loss is permanent and irreversible, cannot be back to normal. So hence we would say that their hearing loss requires some treatment. So how do we treat? Is depend on their severity of hearing loss. If let's say their hearing loss is like maybe mild hearing loss up to severe hearing loss, we will recommend them to wear hearing aids. So there is a range of hearing aids. There is a small one, big one, powerful one, or custom made. So different types of hearing aids. So in Soundlife, any one of them who have diagnosed with hearing loss, they can come to us. We will help them. We can provide them a free the hearing aid trial session, and then from there they get the chance to try up to 4 different brands, and then choose the one that best suit them. So then they can also take it home for hearing aid 7 days home trial. And then if let's say for some of them who is like their hearing loss severe to profound, where hearing aids, even though they wear the most powerful hearing aids, but they can't hear clearly. So this is where we will do certain testing, and then we will recommend them to go for cochlear implants. So hearing aids and cochlear implant is these two is mostly how the device that we recommend while we treating the hearing loss.
I see. Okay, thank you for that, Miss Alia. Okay, so in that case, Dr. Andrew, how do you counsel patients who are initially reluctant to address their hearing loss?
I think it's not just specific to hearing loss, but anything for that matter. I usually give this as an example. I'll tell the patient, I say, okay, Natasha, sorry, I need to use your name. Okay. So let's say
Yeah.
you are my patient.
Yeah.
Okay. And you are reluctant to go for you are reluctant to see Alia lah for the hearing assessment, right?
Mm-hmm.
But I know you are suffering from some form of hearing loss. So this is what I'm going to say. I say, Natasha, let's say unluckily you actually gotten cancer today. Would you rather it be stage 1 or stage 4?
Of course, stage 1.
Of course, right? Who
Yeah,
in
of
the world
course.
wants to be stage 4, right? You know, by the time it comes to stage 4, number 1 is difficult to treat.
Yeah.
Number 2, it's going to be very costly. Yeah, and most of the time it may not even work, right? Even if it's costly, it may not even work in the first place.
Yeah.
So any complication is the same. Whether it is blockage in the heart, whether it's a hearing loss, whether the later you delay, is more difficult to actually treat. It's more expensive and it's more difficult to treat, and the failure rate is higher. So why delay when you can actually arrest it now, right? Any complications for that matter, including hearing loss.
Yeah, exactly. So audience, remember, early prevention is the key.
Yeah. And
Yeah.
one thing to highlight is also a lot of times people think that I still can hear, it's okay, I don't need to do anything. But what they don't know is like the impact of hearing loss. Some research already show that people with moderate hearing loss, they had 3 times more chances to get dementia compared to those who don't have hearing loss at all. Those who have severe hearing loss, they got 5 times more, meaning 500% increased risk to get dementia. So nowadays, there's a saying that we no longer say that the hearing is only helps to overcome your hearing loss or communication issue, but helps to protect your brain. So even in audiology, Now I recommend all my patients minimum hours to use the hearing is 8 hours a day. If you use lesser than that, you don't get the benefit. You don't get the hearing aids to helps to prevent the dementia that could happen on you. Yeah. And some more those who always have delay their treatment of hearing loss, eventually they need to spend more because their processing towards sound is no longer that sharp.
Yes.
It's just like muscle. You have to keep on training your muscle, then you gain the strength. But if you're not training your nerve, your hearing nerves, you don't training your hearing organs, eventually you lose it. So by the time you put on the hearing aids, even though we amplified the sound to the level that you can hear it now, it does not mean that your brain can understand the sounds. If
Mm.
your brain cannot understand the sound, then you require to get a higher processing power hearing aids, which means more expensive hearing aids to give you higher quality sound clarity as well and better
Mm.
noise reduction. All this is count as is actually quite expensive. Yeah.
Yeah.
So the more you delay, actually you just increase the cost for in future lah. Yeah.
Yeah. So, audience, please do not delay if you already show some symptoms. And yeah, because healthy hearing is healthy lifestyle.
Yeah.
So, in that case, I have a question for both of you because we already talked about diabetes and hearing loss. So, are there any inspiring stories of individuals who successfully manage both diabetes and hearing loss? What can we learn from them?
I do have one case study which I prepared some slides. Maybe you can show my screen. Okay, so this is one patient also referred by Dr. Andrew. Okay, 78 years old female complain of reduced hearing sensitivity on both ears, which right is greater than left over the
Mm,
past 6 months. So when they first come in, they also telling that the difficulty, including having a difficulty to have conversation with family members. Sometimes children have to shout for her to hear, and also difficulty talking over the phone. And when the ladies watch TV, they tend to put higher volume. So for
mm,
medical history wise, is this patient is having diabetic and hypertension and has been on medication for the past 9 years. Okay. So when we first done the hearing test, this is the result. So how to interpret the result? First of all, we actually will check the person ear first, and we found out that both ear is clear, and then they have normal eardrum. But when we do the hearing test, the lady is having left side moderate to severe loss, and then the right side is severe to profound sensorineural hearing loss. Okay, so just now we mentioned, if let's say you have the sensorineural type or mixed hearing loss, then uh, the result is like they need to wear the hearing loss is actually permanent. So
mm,
what management that Soundlife Hearing given to them, okay, we explain the overall result, and then we explain about the hearing aids. We also give them the hearing aid trial, and during the trial session we offer them a few styles and brand according to the performance level preferred. Performance level meaning like the technology level lah. For example, iPhone now we have iPhone 16, we have iPhone SE. There's a different budget and then the size, things like that. So we also take into consideration this patient lifestyle and also their budgets. So she had tried both of the Rexton M-Core hearing aids 40 and 60 range. At the end, they also took the opportunity to loan the hearing aid and then try it at home in her own comfort, own environment. So after getting the life experience and benefit, she just wanted to have the device on their own. So at the end, this patient was fitted with a pair of hearing aids. So
mm,
afterwards, during the follow-up, everything seems okay. Whatever complaint that they used to have at the beginning actually is much reduced. Now the family member can communicate at the normal volume. And for patient wise also, she does not require to put high volume anymore while watching the TV. So
Wow.
at the end, I would say when you fix a person's the hearing loss in the family, you also at the same time you fix the home family environment as well.
Yeah. So they can reconnect with their loved ones lah.
Yes, correct, exactly. So
Yeah.
this is also in turns increase their life quality lah. Mm,
Okay, thank you so much for that, Miss Alia. Let's move on to the next topic, which is impact of diabetes and hearing loss on quality of life. Now, since this is our last topic, let's give a little bit of a challenge for both of you. The first question is for Dr. Andrew. In one or two sentences, could you explain how diabetes impacts a person's daily life and mental health?
This is a bit challenging, right? Okay, I think for diabetic, right, the first thing in the morning that's going to happen to them is that they have to start taking the pills, right? Usually the medication is a morning dose, right? And I believe no one loves taking medication, right? I have seen patients who are on like more than 10 different tablets, and that can be in a way like considered their meal of the day already. Yeah. So I think there's a lot of anxiety, there's a lot of stress behind every single diabetic. And of course, at the same time, even though they are taking this medication, they're still worried about complications. We already know how it works just now. We explain the mechanism behind. Yeah. So another thing, of course, is the worry about complications, because no one will know who will have a stroke tomorrow, who will have a heart attack next week, who will have their leg amputated next month, and who will undergo a dialysis next year. No one knows. Yeah, so I think they are always living in a lot of fear, and they worry a lot. And I want to add on to what Alia mentioned just now. When the hearing loss is being managed well, right? Basically, they have better relationship with their family as well. Because I believe in this. Whenever a patient suffer from complications, right, they don't suffer alone. It's always together with their family members. It's always that way. Yeah, that's why I always advise my patient, is your own health, you are responsible for it. So please don't add on the burden to the rest, because it's unfair. Yeah, it's like, remember just now we say, if you have rubbish in your kitchen, you have to throw it outside your house. You're responsible for the cleanliness of your own house. We are all responsible for our own health. Don't, because of your own health, you neglected it, and that's why you're causing problem to others. Is unfair.
Okay, thank you so much for that, Dr. Andrew. So for Miss Alia also, could you explain how hearing loss impacts a person's daily life and mental health?
I would say, first of all, when the person cannot hear well, they will tend to misunderstand what people say. So this will cause communication breakdown. Maybe one simple thing, please help me to get the TV controller. The person misheard it as something else and just ask the family member once again, sorry, come again. Can you repeat one more time? So this will actually make the family member becoming more frustrated, because every message that he convey now has to pick twice or have to repeat. So this will also indirectly will cause a bit more argument or frustration between two parties. Not only for the people who speak the message, but also for the person who listen, because I can't listen well. So I keep on asking you to repeat. And however, many people don't know that when they ask the hearing loss people ask the other party to repeat or to speak louder, right? If the family member speak too loud, it may actually hurt their ear as well. Hearing loss people, if they are due to sensory hearing loss, they might have something called recruitment, meaning they cannot tolerate loud sound as good as us, the normal hearing one. So when we speak too loud, it may injure, it will make them to feel ear pain. So not only that, as Dr. Andrew had mentioned earlier, it can cause the family dynamic to more tense. And at the end, maybe the person who have hearing loss, if all these thing is not addressed right, they will somehow feel embarrassed and also low self-esteem. I would rather not to talk. I would rather not to go out to mix with anyone else. I
Yeah.
rather stay at home or doing the things that not require hearing. For example, reading or watching TV, then read subtitle. So when they actually try to keep themselves in this environment, I would say somehow is isolation, social
Yeah.
isolation. So they tend to have higher chance to get depression because we as a human, our nature is we need to mix with people.
Yeah.
Even for an introvert, also you need to mix with people.
Yeah.
Right? So at the end, what happened is that if let's say the hearing loss is happened to elderly, you imagine as a youngster now we are still working, so we still have our works that require us sometimes to work 8 hours without talking to anyone. But for elderly, what would be their daily routine? Morning wake up, maybe exercise, then after that breakfast. Okay, then after that they will just need to do, they are already retired, so their activity is not so much. So if
Yeah.
let's hearing the basic senses is not there, meaning to say they will just automatically cut down a lot of activities. Yeah.
Thank you for that, Miss Alia. So yes, audience, sometimes when it comes to mental health and isolation, sometimes people who have these problems, they don't even want to address it, or they don't know what it is. So please be a lookout for each other, and I hope all of you learn something from this talk. So now we shall move on to the Q&A. We see there's a lot of questions just now. Now is the time, whatever you want to ask Miss Alia and Dr. Andrew regarding diabetes or hearing loss, now is the time for you to ask.
Okay. So it's a Q&A sections, right? Under
Yeah,
the comment, is there any questions?
it's a Q&A session. Just now I saw a bunch of questions for the previous topic. Maybe we can start with that first. Mm,
I think while we wait for the questions to come in, I want to add on a little bit on what Alia mentioned just now, in which she mentioned about hearing loss, how it is connected to dementia, right?
Mm.
Yeah. So I think one of the understanding we have is that because this hearing is one of our this input, right? The way we input information. So obviously, when there's less input, the brain becomes basically less active, and therefore, it can actually lead to dementia. But ladies and gentlemen, do you know that dementia is type 3 diabetes?
Really?
Yeah, it is.
This one I
Dementia,
don't know also.
the Alzheimer's disease, is the diabetes of the brain.
Oh my god.
Okay, so usually the way we diagnose Alzheimer's or dementia is that we do an MRI scan of the brain. And then you will realize that the brain of the patient is actually shrink. It's actually smaller. Okay, why is it smaller? Because it's not getting enough nutrients. Okay, the sugar is not going into the brain, and therefore the brain is shrinking in size. So it's actually getting smaller. That's what type 3 diabetes, because of the insulin resistance happening in the brain. Because the sugar is not able to go into the brain, therefore the brain is shrinking in size. Yeah. So do you know that if you are a diabetic, the chances of you getting dementia is 80% higher than a normal person. 80%, 80.
It's a lot.
And if you are a dementia patient, or if you suffer from Alzheimer's, okay, there's 80% chance that you are actually a diabetic. So you see, either way, works. So it's all highly connected. That's why dementia is also called the type 3 diabetes. And I'm pretty sure with the help of hearing loss, you are actually drawing yourself closer to one step closer to dementia. So I believe that the very fact that you are here tonight listening to this talk, I believe you are still not suffering from dementia yet. So go for whatever screening you can for your hearing loss, and please reverse your diabetes as soon as possible. And that includes the type 3 diabetes. Okay.
So just now there was just one question we missed out. Doctor, the medication that flush out the sugar together to urine, is that good or no side effects?
From the treatment perspective, it's good because you're pushing the sugar, you're pushing the rubbish out of your body. So this is good. But let's think about it logically. If you are the patient, do you want to take this medication for the rest of your life?
No.
It's still lifelong, right? You still have to take it for the rest of your life. Okay, this is the first question. No, the answer is no, right? Second, we are talking about side effects now. Imagine if your urine is always filled with sugar. Is that good or bad?
That's bad.
Why?
Really more.
Another disease.
I mean, I remember one thing is that sometimes if the sugar, your urine is also sugary, it may also attract the ants.
Correct. Okay, we're coming to that. Other than attracting ants, what else it will attract? Something that's very common among the ladies.
UTI. So UTI.
UTI, correct, you got it. So patients who are on this group of medications, they tend to suffer from frequent UTIs. Yeah, because the sugar is there. So you're literally giving food to the bacteria. So that's why you get frequent UTI. So is there side effects? This is the side effects. And it's logical. It's not something like super hi-fi. No, it's not. It's just logical. Sugar is there. That's why there's UTIs. Yeah.
Okay.
And this patient will tend to go for frequent urination and things like that. All this problem will come. So to me, of course, as a reversing diabetes doctor, the best is reverse it naturally. No medication at all, no insulin, no supplements. And you worry less about complication, including hearing loss.
I see. Okay, thank you so much for that, Doctor. It seems like we don't have any more
There's
questions
one
from the
One
audience.
more. I
Yes.
think we missed out. So
Yeah.
there's one more. So the questions, I think, okay. Sorry. There is someone asking about the carbs. Okay. So if we are not eating any carbs, so what do we eat and can do it for long term or not? And the other one, and probably is the same user lah. What is the long term side effect of non-consumption of carbo?
Okay, the long-term side effect of non-consumption of carbo is doctors will hate you.
Because you are healthy.
Correct, because you're so healthy. Because carbo causes inflammation, right?
Yeah.
So when you don't take carbo, you have less inflammation, you're less likely to actually fall sick. Doctors hate you. Doctors hate you like crazy because they can't make money out of you. Okay, I can assure you one thing. 99% of the doctors out there will tell you that you must take some carbo. They always tell patient you must eat a bit of rice, you must eat a bit of sugar you cannot cut it completely otherwise you will die . Now, I will give everyone a nutrition class now. From the nutrition world, right, I'm pretty sure you have heard of this term called essential amino acid. Essential amino acid means protein. Essential means something you need to take from outside. Your body don't produce it. Okay. So essential amino acid is protein. I'm pretty sure you heard of this thing called EFA, essential fatty acid, which is basically fats lah. That means you also need to take it from outside. And then also there's some essential vitamins, essential minerals, and also you need to drink water. All right. These are all the essential nutrients. Have you heard of the word essential carbohydrates?
No, I don't
It
think
sounds
I.
very wrong when I say it, right? There's no
Yeah,
such
it's
thing
so
as
weird.
essential carbohydrates. That means we don't need carbohydrates, lor. That means we don't need to take it from outside. But why we don't need? What is the reason? It's not because we don't need. We actually need it. But our body is producing it. Remember, I was talking about the liver just now. So one simple example is this. Malaysia. Malaysia produces a lot of durians, correct?
Yeah.
Do you think Malaysia needs to import durian?
No.
No, right? It sounds stupid, right? Even when I say that.
We have
We
enough
never
durians.
import durian. We always export durian because we are a producer.
Yeah.
So when it comes to carbohydrates, it's exactly the same. We are
Ah.
producing carbohydrates. Why in the world do we need to take carbohydrates from outside? We do need it.
But I thought originally they say that you need carbohydrate to generate energy. You know,
Yes.
especially those like construction worker, they require a lot of physical strength for their work.
Yeah. Your body is producing it, ma. So let's say Malaysian, right? We all love durian. You eat a lot of durian. Does that mean you need to import durian from other countries? No, ma, because you're producing so much until we need to export, ma. It's like petroleum, ma. We produce petroleum, ma. We don't need to import, ma. We are exporting. Yeah. Yes, we need the sugar, no doubt. But we are producing it. And furthermore, even if you burn all the sugar, it doesn't matter. Because we still got fats. Our body can burn fats. Do you know that our body is like a hybrid car? Okay, I'm not sure whether you're familiar. You know hybrid cars, right? Hybrid
Yeah.
cars got battery and got petrol. Both,
Yes.
Okay, when the tank is full for both, full tank, full battery, full petrol tank, which one will the car use first?
The fuel. No?
Battery.
Battery.
No, they use the battery first.
Correct, because the car is trying to save petrol. Yes, the car will always use battery first because the car is trying to save petrol. So the car will use all the battery first, the electricity first, finish, no more, then the car will start switching over to petrol and start burning petrol. Our body is exactly the same. Our body will always burn sugar first. Once the sugar is clear off, then the body will start switching to burning fats. That's how the intermittent fasting come in. When you do fasting, your body will initially burn off all the sugar first. No more sugar already, no choice, the body will start burning fats. That's how you lose weight by doing intermittent fasting.
Wow.
So if any doctor or any nutritionist out there who tell you that you need carbo, I'm sorry, that particular person has got zero knowledge when it comes to nutrition. Because I was only talking about basic science just now.
Yeah. Okay, thank you so much for that, Dr. Andrew. So now to the audience, thank you for sticking with us up to this far. I'm sure now Dr. Andrew and Miss Alia, you have any questions for the audience, and maybe they can win the touch and go prize.
Yeah. Okay, I let you start first the questions.
Okay, the question is out right just now. Can anyone share with me what is the prevalence of diabetes in Malaysia?
Okay.
You can either give in percentage form or you can give in like one in how many in Malaysia as of now.
Yeah, for those, please stay online. Please type your questions, and then we will judge it from my screen. But no name, how Oh, okay. Someone
I
has
think
to
on
take.
Facebook it will appear.
On Facebook, it will show the name, Okay. Yeah. So, what is the prevalence of diabetes in Malaysia?
I think only those who come in early will know this answer. Oh, someone got the answer.
Yeah.
Yes, congratulations. Okay, who is the name?
Yeah, I think your team has to pick it up because it's
Yeah. Okay, is that the correct answers?
yes, that's right.
That's right.
It's 1 in 5. That's right.
1 in 5. Okay.
Nice.
Nice. Okay, 20%. Okay, you're right.
Congratulations.
Okay, congrats.
Congratulations. Okay, so this is the first answer. Later on, please, our team will PM you, and then please remember to check your messenger inbox, and then allow us to contact you. Get your phone and anything sent tomorrow. We will share the voucher to you. All right, congratulations. Okay, the winner is, let me check the winner, Alan Tan. Congratulations. All right.
Congratulations.
Tan Xiu Qing, Casey Go, you are right also. Thank you for your participations. Okay. So the next one, still got one more chance. Okay. So the next question is that um, can hearing loss, sensorineural hearing loss, be reversible? Okay. The answer is very simple, yes or no. Okay. Can hearing loss be reversible? The type of hearing loss is sensorineural hearing loss, be reversible. Okay. If it's not, then how can we treat it? Yes. Oh, okay. Alan, you're fast. I think your line is good. Okay. Alan showed the answer no. Okay, you're right. Thank you. Okay. Xiu Qi, you are right also. Yes. But Alan, you got two. How is the situation, moderator?
Yes, yes. Well, Ellen's fast, but we can also give a chance to the second answer also.
Yeah.
I'm
Okay.
not
I
sure
think I
which
think
one.
it's fair lah. Alan is the fastest, and then he
Mm,
won it. So you are right. The answer is no. The sensorineural hearing loss cannot be reversible, and how it is being treated is by using hearing aids. Only with like when it's very very profound where hearing aid can't help, then we would require to use cochlear implants. Yeah. Thank you so much, Alan, for your participations. All right. So I think that's all for our Facebook Live tonight.
yes,
Thank you
that's
so much,
right.
Dr. Andrew, for your insightful sharing. I think a lot of mind-blowing session moments to me as well. Even I is a healthcare professionals. So what you thought is really how to say is not norm lah. Yeah, it's not norm. But I think
I think I'm a quite an abnormal doctor lah. I always
okay.
tell my patients I'm a very naughty doctor because I don't follow the standard guidelines. Because
Yeah.
if I follow the standard guidelines, then my patient will suffer for the rest of their life because they have to take lifelong medications. I believe in doing the right thing by treating the root cause. So you notice everything that I share is always about the root cause. I share what is the root cause of heart attack, what is the root cause of gastric, so what is the root cause of diabetes? Yeah, so it's always about the root cause. So deal with the root cause. Don't deal with the symptoms. If you play with the
Mm,
symptoms, is a never-ending journey. You deal with the root cause, many things will fall into place. Yeah.
mm,
Yeah, exactly. So I'm
yep.
sure many of us, many in the, I mean, the people here, they are interested to know how to get in touch with Dr. Andrew. So
Mm,
over here, our team will share Dr. Andrew contacts. If let's say you would like to find Dr. Andrew and then seek for his advice, or feel free to share this Facebook Live to anyone else who suffer from diabetes. We really hope that give them the chance to understand. No need to share the screen. Give them the chance to actually understand there is a way to make to actually reverse diabetes. All right.
mm,
Yeah. All right. So another one, if any one of you who like to also contact Soundlife, if let's say you have any hearing loss or anyone who suffer from hearing loss, but they require to find someone that can help them, help their hearing, help to improve. Okay, so feel free to also find our contacts in the comment box. All right, so I think that's all for the
yes.
live.
Yes,
Okay.
that's all for tonight.
Thank you
Thank
so
you
much,
so much.
Dr. Andrew.
Okay. Thank
you.
you. Thank you,
Um,
everyone.
all
Okay,
right.
Okay.
thank
Thank
you
you, everyone.
everyone.
Bye bye.
Have a good night. Bye bye.